Erectile dysfunction, or ED, is a common condition that affects millions of men worldwide. It refers to the inability to achieve or maintain an erection firm enough for sexual intercourse. While it can be distressing, it's important to remember that ED is often treatable and can be managed with the right approach. In this video, we'll explore the causes, symptoms, and most importantly, practical steps you can take to address ED before it becomes a long-term issue. Let's start by understanding what ED really is and why it happens. ED can be caused by a variety of factors, both physical and psychological. Common physical causes include heart disease, diabetes, high blood pressure, and hormonal imbalances. Psychological factors such as stress, anxiety, and depression can also play a significant role. Sometimes, lifestyle choices like smoking, excessive alcohol consumption, or lack of exercise contribute to the problem. Understanding the root cause is the first step toward effective treatment. Identifying whether the issue is physical, psychological, or a combination of both will help guide your next steps. Recognizing the symptoms of ED early can make a big difference in treatment outcomes. The most obvious sign is difficulty achieving or maintaining an erection. Other symptoms may include reduced sexual desire or self-confidence. Sometimes, ED can be a warning sign of underlying health conditions, such as cardiovascular disease. If you notice these symptoms persisting for several weeks, it's important to take action. Early intervention can prevent the problem from worsening and improve your overall well-being. Many men hesitate to seek help for ED due to embarrassment or fear. However, consulting a healthcare professional is crucial if symptoms persist. A doctor can help determine the underlying cause and recommend appropriate treatment options. Remember, ED is a medical condition, not a personal failing. Seeking help early increases the chances of successful treatment and can also uncover other health issues that may need attention. Don't wait until the problem becomes severe. Early intervention is always best. One of the most effective ways to address ED is by making positive lifestyle changes. Regular exercise improves blood flow and boosts overall health, which can help with erectile function. Eating a balanced diet rich in fruits, vegetables, and whole grains supports cardiovascular health. Reducing alcohol intake, quitting smoking, and maintaining a healthy weight are also important steps. These changes not only improve ED, but also enhance your general well-being. Stress and anxiety are significant contributors to ED. Learning to manage stress can have a positive impact on your sexual health. Techniques such as deep breathing, meditation, yoga, or even regular walks can help reduce stress levels. It's also important to communicate openly with your partner about your feelings and concerns. Addressing emotional well-being is just as important as physical health when it comes to overcoming ED. Physical activity is a powerful tool in combating ED. Regular aerobic exercise, such as brisk walking, swimming, or cycling, improves blood circulation and heart health. Strength training can also be beneficial. Exercise helps regulate hormones, reduce stress, and improve self-esteem. Even moderate activity, a few times a week, can make a noticeable difference. Start with activities you enjoy and gradually increase intensity for the best results. A healthy diet plays a crucial role in preventing and managing ED. Focus on foods that support heart health, such as leafy greens, berries, nuts, and whole grains. Limit processed foods, sugary snacks, and saturated fats, as these can negatively affect blood flow. Staying hydrated and maintaining a balanced intake of vitamins and minerals also contribute to better sexual health. Small changes in your eating habits can lead to significant improvements over time. Certain habits can worsen ED or make it more difficult to treat. Smoking damages blood vessels and reduces blood flow, directly impacting erectile function. Excessive alcohol consumption can also interfere with sexual performance. Recreational drug use may have similar negative effects. By avoiding these harmful habits, you not only improve your chances of overcoming ED, but also protect your overall health for the long term. A thorough medical evaluation is essential for anyone experiencing persistent ED. Your doctor will likely ask about your medical history, lifestyle, and any medications you are taking. Blood tests, hormone assessments, and physical exams may be recommended to identify underlying conditions. This comprehensive approach ensures that any contributing factors are addressed, and the most effective treatment plan is developed for your specific needs. For many men, medications can be an effective way to manage ED. Drugs like sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, work by increasing blood flow to the penis. These medications are generally safe when prescribed by a doctor, but they may have side effects or interact with other medications. Always consult your healthcare provider before starting any new medication to ensure it's appropriate for your situation. In some cases, hormonal imbalances, particularly low testosterone, can contribute to ED. Hormone therapy may be recommended if tests reveal deficiencies. This treatment involves supplementing testosterone under medical supervision. It's important to monitor hormone levels regularly and follow your doctor's guidance, as improper use can lead to side effects. Hormone therapy is not suitable for everyone, so a thorough evaluation is necessary before starting. Mental health plays a significant role in sexual function. If stress, anxiety, or depression are contributing to ED, psychological support can be highly beneficial. Counseling, therapy, or support groups provide a safe space to discuss concerns and develop coping strategies. Addressing mental health not only improves ED, but also enhances overall quality of life. Don't hesitate to seek professional help if emotional factors are affecting your sexual health. ED can put a strain on relationships, leading to misunderstandings or emotional distance. Open communication with your partner is essential. Discussing your feelings, fears, and expectations can help both of you navigate the situation together. Sometimes, couples therapy can provide additional support and guidance. Remember, you are not alone in this journey, and working together can strengthen your relationship and improve outcomes. Pelvic floor exercises, also known as Kegel exercises, can strengthen the muscles involved in erections. These exercises are simple and can be done at home. By regularly practicing pelvic floor exercises, you may notice improvements in erectile function and bladder control. Consistency is important, and results may take a few weeks to become noticeable. Ask your healthcare provider for guidance on proper technique if needed. Quality sleep is often overlooked, but plays a vital role in sexual health. Poor sleep can disrupt hormone levels and increase stress, both of which contribute to ED. Aim for 7 to 9 hours of restful sleep each night. Establishing a regular sleep routine, avoiding screens before bed, and creating a comfortable sleep environment can all help. Prioritizing sleep supports not only your sexual health, but your overall well-being. Chronic illnesses such as diabetes, heart disease, and high blood pressure are closely linked to ED. Managing these conditions through medication, lifestyle changes, and regular checkups is essential. Keeping blood sugar, cholesterol, and blood pressure within healthy ranges can significantly reduce the risk of ED. Work closely with your healthcare team to develop a comprehensive management plan tailored to your needs. Some medications can cause or worsen ED as a side effect. If you suspect your medication may be contributing to the problem, discuss it with your doctor. Never stop taking prescribed medication without medical advice. Your doctor may be able to adjust your dosage or recommend alternative treatments that have fewer sexual side effects. Open communication with your healthcare provider is essential for finding the best solution. In addition to conventional treatments, some men explore alternative therapies for ED. Acupuncture, herbal supplements, and certain vitamins are popular options. However, the effectiveness of these therapies varies, and some may interact with medications or have side effects. Always consult your healthcare provider before trying alternative treatments to ensure they are safe and appropriate for your situation. Vacuum erection devices are non-invasive tools that can help men achieve an erection. These devices use a pump to draw blood into the penis, followed by a constriction ring to maintain the erection. They are generally safe and can be used in combination with other treatments. If you're considering a vacuum device, ask your doctor for recommendations and proper usage instructions to ensure safety and effectiveness. For some men, penile injections may be recommended when other treatments are ineffective. These injections deliver medication directly to the penis, resulting in an erection within minutes. While effective, they require proper training and should only be used under medical supervision. Discuss the risks, benefits, and technique with your healthcare provider before considering this option. In rare cases where other treatments fail, surgical options, such as penile implants, may be considered. These devices are surgically placed inside the penis and allow for controlled erections. Surgery is usually reserved for severe cases and comes with risks and recovery time. A thorough discussion with your healthcare provider is necessary to weigh the pros and cons before making a decision. Regular follow-up with your healthcare provider is crucial for monitoring progress and adjusting treatment as needed. ED can change over time, and ongoing communication ensures that your treatment remains effective. Follow-up visits also provide an opportunity to address any new concerns or side effects. Stay proactive in managing your health for the best possible outcomes. It's important to set realistic expectations when addressing ED. Improvement may take time, and not every treatment works for everyone. Celebrate small victories along the way, and remain patient with the process. Working closely with your healthcare provider and partner can help you stay motivated and focused on your goals. Remember, progress is often gradual, but persistence pays off. Unfortunately, the internet is full of products and treatments that promise quick fixes for ED. Many of these are unproven, unsafe, or outright scams. Always rely on evidence-based treatments and consult your healthcare provider before trying anything new. Protect your health and your wallet by avoiding miracle cures and sticking to reputable sources of information and care. ED becomes more common with age, but it is not an inevitable part of getting older. Many older men maintain healthy sexual function with the right lifestyle and medical support. Age-related changes in blood vessels, hormone levels, and overall health can contribute to ED, but proactive management makes a difference. No matter your age, there are steps you can take to improve your sexual health. Healthy erections depend on good blood flow to the penis. Conditions that affect blood vessels, such as atherosclerosis or high cholesterol, can lead to ED. Maintaining cardiovascular health through diet, exercise, and medication when necessary is crucial. If you have risk factors for heart disease, addressing them can also improve erectile function. Remember, what's good for your heart is good for your sexual health. Sexual health is influenced by both physical and psychological factors. The mind-body connection means that stress, anxiety, or negative thoughts can impact physical performance. Practicing mindfulness, engaging in enjoyable activities, and seeking support when needed can help break the cycle of anxiety and ED. Taking care of your mental and emotional health is just as important as addressing physical issues. Effective communication with your partner can ease the emotional burden of ED. Sharing your feelings and concerns openly fosters understanding and support. It can also help reduce performance anxiety and strengthen your relationship. If communication is difficult, consider seeking guidance from a counselor or therapist. Remember, you and your partner are a team, and working together can make a big difference. Overcoming ED is a journey, and setbacks are a normal part of the process. If you experience a temporary return of symptoms, don't get discouraged. Reflect on possible triggers, such as stress or changes in routine, and adjust your approach as needed. Stay committed to your treatment plan and reach out for support if necessary. Remember, persistence and patience are key to long-term success. Keeping track of your progress can help you stay motivated and identify what works best for you. Consider keeping a journal of your symptoms, treatments, and any changes in lifestyle. Share this information with your healthcare provider during follow-up visits. Tracking progress allows for timely adjustments and helps you celebrate improvements along the way. Confidence plays a major role in sexual performance. Focus on your strengths and achievements, both in and out of the bedroom. Positive self-talk, setting achievable goals, and celebrating progress can boost your self-esteem. Remember, ED does not define you, and building confidence is an important part of the recovery process. Knowledge is power when it comes to managing ED. Take time to learn about the condition, treatment options, and lifestyle changes that can help. Reliable sources include healthcare providers, reputable websites, and educational materials. The more you know, the better equipped you'll be to make informed decisions and advocate for your health. ED affects both partners in a relationship. Supporting each other through open communication, patience, and understanding can ease the emotional impact. Encourage your partner to seek help and participate in treatment decisions. Working together strengthens your bond and improves the chances of overcoming ED as a team. Maintaining motivation is essential for long-term success in managing ED. Set realistic goals, track your progress, and celebrate small achievements. Surround yourself with supportive people and seek encouragement when needed. Remember, every step forward is progress, and staying motivated will help you overcome challenges along the way. Once you've made progress in managing ED, it's important to prevent recurrence. Continue with healthy lifestyle habits, regular exercise, and medical checkups. Stay vigilant for any changes in symptoms and address them promptly. Prevention is an ongoing process, and maintaining your health is the best way to avoid future issues. Establishing a daily routine that includes exercise, healthy eating, and stress management can make a significant difference in sexual health. Consistency helps reinforce positive habits and supports long-term improvement. Find a routine that works for you and stick with it, making adjustments as needed to fit your lifestyle and goals. Medical knowledge and treatment options for ED continue to evolve. Stay informed about new developments by consulting your healthcare provider and accessing reputable sources. Being proactive about your health ensures you benefit from the latest advances and can make the best choices for your situation. ED is often surrounded by stigma and misconceptions, which can prevent men from seeking help. Remember, ED is a medical condition that can affect anyone. Talking openly about your experiences and seeking support helps break down barriers and encourages others to do the same. You're not alone, and reaching out is a sign of strength, not weakness. With the right approach, most men can successfully manage or even reverse ED. Long-term success depends on a combination of medical treatment, healthy lifestyle choices, and emotional support. Stay committed to your health, keep an open mind about new options, and remember that improvement is possible at any stage. Your journey to better sexual health is ongoing, and every positive step counts. Let's recap the most important steps for fixing ED before it's too late. Understand the causes, seek medical evaluation, adopt healthy lifestyle habits, manage stress, communicate openly, and stay informed. Each of these steps plays a vital role in improving sexual health and overall well-being. Remember, taking action now can prevent long-term issues and restore your confidence. There are many resources available for men dealing with ED. Healthcare providers, support groups, and reputable online platforms offer information and guidance. Don't hesitate to reach out for help and connect with others who understand your experience. Support is available, and you don't have to face ED alone. The most important step is to take action today. Whether it's scheduling a doctor's appointment, making a lifestyle change, or starting a conversation with your partner, every step counts. The sooner you address ED, the better your chances of successful treatment and recovery. Don't wait. Your health and happiness are worth it. Overcoming ED is a journey that requires patience, persistence, and support. Celebrate your progress, no matter how small, and remember that setbacks are part of the process. Stay positive, keep learning, and reach out for help when needed. You're taking important steps toward better health and a more fulfilling life. In conclusion, erectile dysfunction is a common and treatable condition. By understanding the causes, seeking help early, and making positive changes, you can regain control of your sexual health. Remember, you're not alone on this journey, and support is always available. Take the first step today and move forward with confidence toward a healthier, happier future.